Sherlock Holmes, unquote. So as a forensic nurse, we have to collect proper data. So overview of today's presentation, overview of violence, interpersonal violence and related terminology, typology of violence and the nature of violent acts, then interpersonal violence in detail, which will deal with the magnitude, burden, and the consequences, and the types, which include children, women, elderly, psychosocial abuse, substance abuse, occult and religion, and lastly, trauma-informed care and role of forensic team professionals. So you all might be knowing that Forensic Nursing Week we are celebrating from 5 to 11 November. Any patient can be a victim of violence. So interpersonal violence affects hundreds of millions of people, but it can be prevented. Forensic nurses are vital to delivering. Is it visible? Slides are moving.
Yes, ma'am.
So interpersonal violence affects hundreds and millions of people, but it can be prevented. Forensic nurses are vital to deliver safe, trauma-informed, thorough care to patients who have experienced violence or trauma. So forensic nurses, they are specially trained to provide trauma-informed.
Madam, excuse me.
Yes.
Madam, excuse me. Very sorry to disturb you. Can you keep full screen? The side there will be option full screen.
Full screen, then it was not moving actually. Now is it visible?
Acha, it's visible. If it's full screen, it will be a little more clarity. Anyway,
So,
no problem. Ma'am. You continue.
Introduction slide is visible to you now. Which slide is now showing? Is it
visible,
moving now?
But if it's full screen, it will be little more.
Full screen, it's not moving actually.
Okay. No problem, madam. Then continue, ma'am. Sorry.
Yeah, and I will share the PowerPoint also afterwards,
Okay.
so that you can share it to the participants also. So violence. So first we should understand about violence. So according to WHO 2021, violence and unintentional injury related deaths are a public health problem which affects more than 4 million people of all the ages worldwide. According to WHO, tens and millions of non-fatal injuries, they are treated in emergency settings and other locations throughout the world. So our role starts because the patient may be present anywhere. They can come in the OPD, they can come in the emergency setting or any other location. The prevalence of injuries related to violence creates a need for enhanced knowledge. So this is a step which is taken by Vibrant College and NSS. So we are having an enhanced knowledge of what constitutes trauma, as well as the proper forensic evidence collection and the preservation procedures. The typology of violence, in that violence is divided into three broad categories. First is self-directed violence, second is interpersonal violence, and third is collective violence. You all know about self-directed violence. Collective violence is what? Which includes war, terrorism, or state which perpetrates violence in form of genocide or torture. But we are not interested into that much. But our focus will be today on interpersonal violence. This is a very vast topic. So typology of violence, when you see self-directed is suicidal behavior, self-abuse. Violence is interpersonal, and this can be family, partner, community, and collective. So within the typology of violence, 4 types of violent act can occur. So this is the nature of violent act. So when which is visible physically, or there can be a sexual abuse, there can be some psychological damage, injury, or emotional abuse and neglect. So under this violence, we can categorize 4 types of violent acts, which can be in any of these four categories. So abuse, you all know, it is an act of commission. And what is neglect? It is defined as the act of omission. Means if you're not doing something, because of that, if something is happening, that is neglect. And because of your act, something is happening, that is abuse. I hope it's clear to you. So interpersonal violence, why this topic is selected is because it is a pervasive public health, human rights, and development challenge. According to Rosenberg, it affects families, communities, nations, and generations. And the bad effect of this interpersonal violence is that the individual's lifelong vulnerability to a broad range of emotional, behavioral, and physical health problems. Interpersonal violence directly affects healthcare expenditures worldwide. It affects national and local economies, stunting development, causes inequality, and it erodes the human capital, according to WHO. So you can see the catastrophic effects of interpersonal violence. So the burden of interpersonal violence, WHO Global Health estimates indicate that 1.4 million people died in 2017. So the data which I am showing is a data of 2017. So by that itself, you can see of those deaths, 35.3% were due to interpersonal violence. And out of that, 83% of all violence-related deaths occurred in low and middle-income countries, and 91.4% of deaths due to interpersonal violence occurred in low middle-income countries. So the nature of interpersonal violence, again, you can divide it into two parts. First is family or partner violence and community violence. The family and partner, you know, when the person is from the family or a close partner. So it refers to violence within the family or between intimate partners. It includes child maltreatment, dating, intimate partner violence, and elder maltreatment. Means everything is happening within the family. Second is community violence. So what is community violence? It occurs among individuals who are not related by family ties. So they are not related to each other, but who may know each other. It includes youth violence, bullying, assault, rape, or sexual assault by acquaintance or strangers, and violence that occurs in institutional settings such as school, workplaces, and prison. Then we term it as community violence. I hope nature is clear to you. Shall I move to the next slide?
Yes, ma'am.
So the consequence of interpersonal violence. Violence blights the life of individual for decades. Beyond death, physical injury, and disability, violence can lead to stress that impairs the development of nervous and immune system. Consequently, people exposed to violence are at increased risk of wide range of immediate and lifelong. They will be affected with behavioral, physical, or mental problems, including being a victim. So either they end up being a victim or perpetrator, means the person who starts the violence. So either they will become perpetrator or they may become victim in the near future. Violence can also undermine the social and economic development of whole community and society. So the consequences I have put into 6 headings. First is physical or psychological injury. Second, linked to infectious disease. Third, increased risk of reproductive problems. Fourth, increased risk problem. Fifth, increased risk of future violence and increased risk of non-communicable diseases. So first, I am telling about all the consequences about interpersonal violence. Then I will go into detail about the child, what happens in the child, what happens in the women, what happens to the elder people. So first we will see what is physical or psychological injury. So whether they are physical injury or psychological injury, always what happens, we don't recognize it. And it ranges from self-limiting to severe. Physical injuries include laceration, bruise, wounds, fractures, broken teeth, ocular damage, burns, internal injuries, and head injuries. Such injuries, which are caused by highly lethal means such as firearms, may lead to disability, including brain damage, amputation, or paralysis, according to Buchanan. Second consequence is linked to infectious disease. So if you see the interpersonal violence, the association between sexual and physical violence and infectious diseases, particularly the STIs and HIV/AIDS, is well supported by many research studies. The importance of gender-based violence as a driver of HIV/AIDS in women is so prominent that multilateral donors such as United Nations Women, they view elimination of violence. If you eliminate violence, they are saying against women and children as the key strategy for advancing prevention to infectious diseases. And the third consequence is increased risk of reproductive problems. You all know many problems will happen like unintended pregnancy, teen pregnancy, and the victims' associated risk behaviors. This has been studied by many researchers like Hillis, Silverman, and Fisher and others. For example, violence against girls increase the future risk of adverse pregnancy outcomes, such as fetal death. In addition, mortality for young children is significantly higher when their mothers are victims of interpersonal violence. So you can see it has an effect on child, or you can say for generations. A review of studies from 17 low-middle income countries show that the interpersonal violence leads to increased prevalence of pregnancy-associated mental health disorders, such as postpartum depression, which impairs a mother's ability to provide a safe, stable, and nurturing environment for her children. Fourth consequence, the WHO Mental Health Survey findings from 21 countries demonstrate that violence during childhood is associated with mood, anxiety, behavior, and substance disorders, as well as suicidal behavior during adulthood. So this was a study was done by Kessler and others. So they demonstrated that there is a chance, there is an increased risk of mental health problems. So the mental health effects can be classified into 5: PTSD, severe anxiety and uncontrollable thoughts, depression, low self-esteem, suicidal thoughts or attempts, alcohol and drug abuse. Along with that, there will be emotional and spiritual effects. First, hopelessness, feeling unworthy, apprehensive and discouraged about future, and they lose their ability to trust, questioning and doubting the spiritual faith, and they becomes unmotivated. Then the fifth consequence is increased risk of future violence. So they may, I already told you, either they will become a perpetrator or they will become a victim. So experiencing child maltreatment and witnessing partner abuse have consistently been shown to increase the risk of becoming either a perpetrator or a victim of sexual violence and IPV as an adult. So this has been done by research study by Capaldi and others. So there is a intergenerational effect of childhood violence, which increases the risk that men will mostly become perpetrators and women will mostly become victims, and in some cases, vice versa also. And the sixth consequence is increased risk of non-communicable disease. So violence during childhood is associated with non-communicable disease that often become evident decades later. Exposure to childhood violence, according to a study by Lozano, Norman, and others, they showed that it leads to 4 NCDs that accounted for 60% of the 53 million deaths which are globally happening, like the cardiovascular disease, the cancer, the chronic lung disease, and diabetes. So there has been a link which has been found that those victims were exposed to childhood violence. Then another study by Anda and Hill shows that childhood violence is associated with major risk factors for this disease like alcohol abuse, tobacco use, physical inactivity, obesity. Beyond health effects, there are serious psychosocial effects of childhood violence, which are observed decades later. Why? Because they will have financial problems. They will not be able to adjust in the family. Job, there will be problem. They will be having anger and stress. So what is the basic science or what is the evidence behind violence? So why violence is bad or what is the scientific basis for that? The biological underpinnings of the empirical association between exposure to violence and subsequent major cause of mortality has been established through basic science. So what happens? Recent evidence demonstrate that traumatic stress such as that associated with violence in childhood, it impairs brain architecture, both structure as well as function, immune status, metabolic systems, and cellular immunity response, according to Anda and others. According to Dennis, it is clear that early exposure to this toxic amount of stress which the child is experiencing in childhood, it confers lasting damage at the most basic level of the nervous, endocrine, and immune system, that such exposure can alter the physical structure of DNA, that is known as epigenetic effects. According to Haim and Binder, important research summarizing the effects of early childhood experience suggests that these multifaceted gene-environment interactions that cause negative health consequences after exposure to chronic stress also appear to confer positive health consequences. Means if these gene-environment interactions can be changed. So if we give them a positive environment, what will happen? These effects can be reversed also, according to Hillis and others. So I hope this much is clear to you. So we have studied about violence, we have studied about interpersonal violence, and we have studied the impact, the magnitude, and the consequence of violence. I hope this much is clear to you.
Yes, ma'am.
Okay, shall I move to the next? Okay, the next topic is types of interpersonal violence. So this is the major topic which I have to take, but before that you have to understand what is interpersonal violence and what is the effect. So interpersonal violence is, first heading is child maltreatment, including youth violence. Second, violence against women and domestic violence. Third, elder maltreatment. Fourth, psychosocial abuse. Fifth, substance abuse. Sixth, occult and religion. So first is child maltreatment. So we will start from the starting itself, that is child. So child maltreatment is the abuse and neglect of people under 18 years of age. It includes all forms of physical, emotional ill treatment, sexual abuse, neglect or negligent treatment, or commercial or exploitation resulting in actual or potential harm to child's health, its survival, its development, or dignity in the context of relationship of responsibility, trust, or power. 4 types of child maltreatment are generally recognized. I hope you have made a correlation. I told you 4 types of violent acts are there, which I already told you. Physical, right? Then sexual, psychological, and neglect. So these are the 4 violent acts which can happen in any of the types which I am going to tell. So I have taken that part earlier itself. Epidemiology, each year, millions of children are investigated by Child Protective Services for child abuse and neglect. In 2014, over 3.2 million children were subjects of child maltreatment reports. Of those, 20% were found to have evidence of maltreatment. Statistics in India is also not very good. A total of 1.68 lakh cases of crime against children were registered during 2022, showing an increase over 2020, that was 1.28 lakh cases. In percentage terms, major crime heads under crime against children during 2022 were kidnapping and abduction, 45.7%, and Protection of Children from Sexual Offences Act 2012, 39.7%, including child rape. The crime rate registered per lakh children population is 36.6 in 2022 in comparison with 33.6 in 2021. So you can see the rapid rise in 1 year. India is said to have reported over 24 lakh instances of online child sexual abuse during 3-year period between 2017 and 2020, with 80% of the victim being girls below the age of 14 years. So it is not a very good picture. It is a grim picture of India also. So under children, first, neglect. So what is neglect for children? It may include inadequate healthcare, education, supervision, protection from hazards in the environment, unmet basic needs such as clothing, food. Neglect is the most common form of child abuse. Next is physical abuse, which includes beating, shaking, burning, biting. The threshold for defining corporal punishment as abuse is clear. Rib fractures are found to be the most common finding associated with physical abuse. Third type is psychological abuse in children, which includes verbal abuse, humiliation, acts that scare or terrorize a child, which may result in future psychological illness of the child. And the last, but the most severe one, is the sexual abuse, is defined as the involvement of dependent, developmentally immature children and adolescents in sexual activities which they do not fully comprehend, to which they are unable to give consent, or that violate the social taboos of family roles. Some cases of sexual abuse do not need to involve oral, anal, or vaginal penetration and may include exposure to sexually explicit material, oral genital contact, genital to genital contact, genital to anal contact, and genital fondling. So these all things are also included in as child abuse in children. The etiology, at the individual level, the child may have certain risk factors like child's disability. If the child is a disabled child, or the mother is an unmarried mother, or maternal smoking, or parents' depression. So these are some of the risk factors at the individual level. Some risk factors may be present at the familial level, like the domestic violence at home, more than 2 siblings at home. At the community level, there can be lack of recreational facility and societal factors like poverty. Other factors are the children who are orphans, or the children, they are living in unrelated adults' home and being a child previously reported to Child Protective Services. So all these are the risk factors at individual, familial, community, and other level, which increases the chance of child abuse. This I have already mentioned, the last box which I am showing. There are some protective factors also that decrease the risk of child maltreatment. So the family support and parental concern. So as a nurse, we should always use opportunities to educate the parents. Parental education is very important so that they can develop social support and resilience. In child abuse, history and physical examination, physical abuse should be considered in the evaluation of all the injuries of children. Any children is coming, physical abuse has to be ruled out. A thorough history of physical illness is important to make a correct diagnosis. Important aspects of history taking involve gathering information about the child's behavior before, during, and after the injury occurred. History taking should include the interview of each caretaker separately and verbal of the child as well. The parent or the caretaker or guardian should be able to provide the history without interruptions in order to be not influenced by physicians' questions or interpretation, or whatever is as per the situation or institutional policy. But history taking and physical examination is a must in physical abuse. So when to suspect physical abuse in a child? This is the second most common type of child abuse. I told you neglect is the first one, and second is the physical abuse. So when you will suspect that the child is having physical abuse, when there is an injury in a non-verbal child, the child is not telling anything, but the child is having injury. Injury inconsistent with child's physical abilities and statement of harm from the verbally speaking child. Mechanisms of injury not plausible. Not plausible means not believable, not creditable. Multiple injuries, particularly at varying ages. Then bruises on the torso. Torso, I hope you all know. So the body part, human body part, which is apart from the head, neck, arms, and leg is known as torso. We also call it as trunk. So if there are bruises on the trunk, ear, or neck in a child younger than 4 years of age, then burns to genitalia, that you should suspect as physical abuse. Stocking or gloving or patterns. When you wear stockings and gloves, there is a defined marking, right? So you should be concerned if such type of distribution is there. For example, if the person is abusing a child, the child will develop this type of injury. There will be uniform distribution, like gloves when we are wearing. There will be a round line. There will not be any interpretations, right? And caregiver is unconcerned about injury. An unexplained delay in seeking care or inconsistencies or discrepancies. So this also you should be a warning signal to you. Means the caregiver is not concerned about injury and an unexplained delay in seeking health care and a non-ambulatory infant with any injury. So these are the times when you have to see that you should suspect physical abuse. Then there is a mnemonic which you can remember 10-4, right? So 10 is torso, ear, neck, and 4, right? So T is torso, E is ear, N is neck, and 4 is what? Less than 4 years of age, or any bruising in a child less than 4 months of age. So this is the mnemonic which is very useful to find out the bruising locations regarding physical abuse. A few injuries that are highly suggestive of abuse include retinal hemorrhages, posterior rib fractures, and classic metaphyseal lesions. So the first type of physical abuse which happens in a child is bruising. Bruising is the most common one, and often we miss it because we think is it visible?
Yes, ma'am.
So bruising in non-ambulatory children is rare and should raise suspicion for abuse. So if the child is not moving, child is fractured.
If
Or
it is not visible.
now,
No, ma'am. Screen is not visible.
let me share again.
Ma'am, what's that very tower?
And what happened? I don't know. Is it visible now?
Yes, ma'am.
Yes, ma'am.
Okay.
Yes, ma'am.
Maybe some technical glitch.
Yes, ma'am. Visible, visible.
Okay, thank you. So bruising is the most common sign I told you. So if the child is non-ambulatory, we should be suspicious for abuse because the child is not moving. Then the child can't get injury. So it will be definitely physical abuse. The most common areas of bruising in non-abused children are the knees and chin, as well as bony prominence, including the forehead. And the most common area of bruising for abused children are head and face. So this is the way in which you can just have an idea. Then burns, I told you, they will have sharp lines of demarcation that involves genitals and lower extremities in a symmetric pattern. If the child is accidentally falling into hot water or tub, what will happen? The pattern will be asymmetric. But if the parents or the caretakers or the abusers are dipping the child, there will be a symmetric pattern. So that is the way in which you can identify. So first type is bruising. Second is abusive head trauma, AHT. So abusive head trauma, also known as shaken baby syndrome. So what is shaken baby syndrome? You all know? Forceful shaking of an infant or a toddler, right? What happens when the child is not, for example, the child is not stopping crying. So the parents sometimes in exasperation may shake the child. So sometimes it may become vigorous shaking. So it may cause abusive head trauma. It is a form of child physical abuse with the highest mortality rate, greater than 20%. Symptoms may include vomiting or as severe as lethargy, seizures, apnea, or coma. See? So the presentation is very subtle and we will not be able to identify it. Only like vomiting or some lethargy is there, sometimes seizure. So we will give treatment for seizure, apnea, or last stage coma or apnea only we will be little bit alert. Findings suggest, this is the suggestive finding of abusive head trauma, retinal hemorrhage, hematoma, subdural hematoma, and diffuse axonal injury. So an infant with abusive head trauma may have no neurological symptoms, may be diagnosed with gastroenteritis when they are coming to the hospital or to the OPD, or like otitis media, GERD, colic, or unrelated entities. Often, as per golden rule, head ultrasound is used as initial evaluation in young infants, sorry. However, it is not the test of choice in emergency setting. We don't have that setting, all those procedures. So best, at least an ophthalmic examination can be done to find out retinal hemorrhages. Then we can think of doing the head ultrasound or other procedures or CT or whatever may be. So second is abusive head trauma. Third is skeletal trauma. Under physical abuse, I am telling the third point, that is skeletal trauma. 80% of abusive fractures occur in non-ambulatory children, particularly in children less than 18 months of age, when they themselves are not walking or they have some disability or because of some disease condition, they are not able to move. The most important risk factor for abusive skeletal injuries age, I told you, that is less than 18 months of age. There is no fracture which is pathognomic for abuse, but there are some fractures that are suggestive of abuse. These include posterior or lateral rib fractures and corner or bucket handle fractures. What are corner and bucket handle fractures? They are the metaphyseal fractures. So we should be very careful. If these type of fractures are present, then we should find out. This happens at the long bones and resulting from a twisting mechanism, means the child has been twisted or the arms have been twisted. Other highly suspicious fractures are sternal, spinal, and scapular fractures. The fourth type of trauma is abdominal trauma. So this is the second most common cause of death from physical abuse. After AHT, most of these children will not show any outside finding. There may not be abdominal bruising on physical examination. Therefore, what we can do, we can screen for liver function test, amylase, lipase, and test for hematuria to find out whether any organs have been damaged or any toxic level or bleeding is happening. Any positive result can indicate the need for imaging studies. Then we can think of imaging studies, particularly abdominal CT. Fourth is sexual abuse. So sexual abuse, when you do, this may be a concern because usually if the child is, every child will be a modest child. But if the child demonstrates behavior such as undressing in front of others, touching others' genitals, as well as looking at others when they are underdressing, there may be a concern for sexual abuse. It's important to understand that a normal physical examination will not rule out the sexual abuse. Indeed, the majority of sexual abuse victims have a normal anogenital examination. So most you have to do a history taking, as well as in most cases, the strongest evidence that sexual abuse has occurred is the child's statement. So we have to listen to the child, what the child is telling, and the behavior of the child has to be observed. Then the fourth one is neglect. Fourth type of violent act which can happen to a child is neglect. So physical examination in a neglected child may not only demonstrate signs of physical abuse, but may show signs of neglect also. This includes poor oral hygiene, extensive dental caries. So if the child is having these characteristics, poor oral hygiene, extensive dental caries, malnutrition with stunted growth, untreated diaper dermatitis, or untreated wounds, so that shows neglect. All healthcare providers are mandated reporters as such. So we have to report to the concerned authorities if we see any of the abuse or neglect. They are required to make a report to the child welfare when there is a reasonable suspicion of abuse or neglect. One does not need to be certain, but a reasonable suspicion is enough that they will find out afterwards. It's our duty only to report it. This mandated report may be life-saving for many children. An interprofessional approach. So we should have an interprofessional approach with the doctors and other team members so that we can, along with the child abuse specialist, if they are there, then it will be very good for the child survival. So evaluation, any child who are coming to you, who is younger than 2 years old, for whom there is a concern for physical abuse, should have a skeletal survey. So any injury if the child is showing, you should take X-ray. And additionally, the child's younger or sibling also less than 2 years of age of an abused child should have a skeletal X-ray. Maybe it is running in the family. Maybe only one child has come because it is severe. So we should always take the skeletal X-ray of the sibling also. Laboratory evaluation, I have already told you, right? Regarding bone, you can understand calcium, magnesium, phosphate, alkaline phosphatase, all these give a clue to the bone density and what happens to the bone. Then hematology, CBC, coagulation, PT, metabolic, glucose, all those things you can do and find out the platelet functioning also, if there is any bleeding, internal bleeding or some bleeding is happening. So this photo X-ray is showing the, which I was telling, the metaphyseal fracture. Now the treatment and management of child maltreatment. Initial management of abused child involves stabilization, including assessing the patient's airway, breathing, and circulation. Then once stabilized only, you should take history and physical examination. Any suspicion, immediately concerned authorities to be informed. And if the child is presenting in the OPD, you have to transfer the child to the hospital and for lab and radiological evaluation, and the care can be continued. Even if a child was transferred to another physician or facility, the physician or the healthcare worker who first sees the child has the responsibility to be a mandated reporter. This is very important. You have to remember that we can't escape our responsibility. If we are the first person, then we should report. So we become the mandated reporter. So it is not the responsibility of the physician to identify the perpetrator. We may not identify. We may be or we may not be. But it is to recognize potential abuse. So healthcare professionals only have to find out whether abuse happened, and we will report it to the concerned authority so that investigation can be done and the child can be given protection. The physician can continue to advocate for the child, ensuring that the patient receives appropriate follow-up services. So I hope it is clear, mandated, reported. Okay. Victims of sexual abuse, if you are encountering, treatment of physical abuse will be different, sexual abuse will be different. So sexual abuse have multifaceted effect on the child. Physical, mental, their psychosocial needs to be addressed. Besides, we have to find out the baseline STI. Pregnancy testing should be performed, as well as empiric treatment for HIV, gonorrhea, chlamydia, trichomonas, bacterial vaginosis infection for the adolescent victim. And if they are presenting within 72 hours of the incident, then we can think of emergency contraception also. Pre-pubertal patients are not provided with the prophylactic treatment due to low incidence of STIs in this age group. Urgent evaluation is very important, those with anogenital injury, so that we can collect the forensic evidence optimally in less than 72 hours will be better for urgent child protection and in those suicidal ideation and other form of symptom or injury. The next aspect which is always overlooked is youth. Youth also is a part of child. So these two parts I'm merging together. WHO defines adolescent as individuals in the age group of 10 to 19 years and youth as 15 to 24 years, while young people covers the age of 10 to 24 years. So different terminologies are there. So youth violence means 10 to 29 years. Whoever is coming, that will be youth violence, and it generally takes place outside the home. It includes bullying, offline, online, physical fighting, to more severe physical assault and sexual assault to homicide. I hope child maltreatment is clear to you. Second part is violence against women. So violence against women is one of the most prevalent human rights violations. It has long-term effects and it prevents them from fully participating in the society. Types of violence against women. First is intimate partner violence. Second, domestic violence. Third, sexual violence. Fourth, femicide. Fifth, human trafficking. Sixth, female genital mutilation. Seventh, child, early and forced marriage. Then eighth, online or technology facilitated violence. So you can see a lot of violence against women. So the first one is intimate partner violence. You all know it is caused by a partner or an ex-partner. And this is the most commonest form of violence which is experienced by women globally. Intimate partner violence can include acts of physical violence such as slapping, choking, burning. Sexual violence include spousal rape. Psychological violence include fear and intimidation or forced isolation. Economic violence by taking total control of the finances, withholding access to money to the lady, or to forbidding of attendance at school or employment, among others. So all these constitute intimate partner violence. Then domestic violence. So intimate partner violence is a part of domestic violence. Okay. So why I have taken it in two headings is that domestic violence is a umbrella term. So in that there may be violence on child also. There may be violence on the elderly people who are living in their particular home, right? But intimate partner violence is specifically on the lady itself. So intimate partner violence is one of the manifestations of domestic violence. Domestic violence is violence that occurs within the private domestic sphere between individuals who are related either through intimacy or through blood. Domestic violence is not confined to women. For example, that's what I was telling. It includes child abuse and elderly abuse in the domestic sphere. So this cycle of abuse, I think you all know about, right? First, there will be a battering stage, and there will be honeymoon stage. Because they feel guilty, they will bring flowers, and they will say, "I love you." All those things, they will make excuses, and then again tension will build, and again escalate. The violence will escalate. So this is the cycle of abuse which happens. Then the power and control wheel. So this is given by Minnesota Domestic Abuse Intervention Programs. So why this happens? Because there is an imbalance of power and control. So one people want to dominate over the other people. So they may resort to physical violence, sexual violence by any of the methods which I told you, right? Emotional abuse, isolation, right? So this is a case of imbalance of power and control. So in India, 32% of ever married women reported having experienced physical, sexual, or emotional violence by their husbands in their lifetime. According to the National Family Health Survey 5, which happened in 2019 to 21, 29.3% of married Indian women between the ages of 18 to 49 have experienced domestic and sexual violence. 3.1% of pregnant women aged 18 to 14 years have suffered physical violence during their pregnancy. So, according to NFHS data, 87% of married women who are victims of marital violence do not seek help. So what are the contributing factors? Of course, gender disparities, right? Male superiority or entitlement. Then substance abuse, that also creates violent tendencies in the person because it impairs the judgment. Dowry culture. This is another thing. There is a strong correlation between domestic violence and dowry system. Dowry Prohibition Act has been passed. Despite that, there is still bride burning and violence. When you are going through the newspapers or through the media, you can see still these cases are going on. So financial stresses also add tension in the relationship. Then there is a socio-cultural norm is also a factor. Like we are having a patriarchal system. Patriarchal system prioritizes male authority and control over women. Violence often stems from the notions of ownership of women's body, labor, reproductive rights, reinforcing a sense of dominance. So they want to have a sense of dominance. Then social conditioning also says that marriage is the ultimate goal for women. Indian culture often glorifies women who exhibit tolerance and submission, discouraging from leaving abusive relationships. So along with the socioeconomic stresses, if along with that there is poverty, unemployment, mental health issues, and if they themselves don't know about the laws or the protections, legal protections which are available, they also may become a victim. Domestic violence, you can see based on race also it may differ, class, upper class, middle class, and so there will be a difference, gender identity, there will be difference, sexual orientation, religion, and other markers are there. So from that point of view also domestic violence varies. So many acts are there which I am not going to tell you. 2005 one act I will say, Protection of Women from Domestic Violence Act. So it is in 2005, this protects women from domestic violence. So like that many rights are there, many laws are there which we should be aware. Then sexual violence. It is a sort of harmful, unwanted sexual behavior without consent. So sexual violence, first is sexual harassment. So sexual harassment can take a variety of form, from looks, in way of looking, leering at a person, or saying obscene words. Starting from there, physical sexual harassment starts through physical contact and of a sexual nature. So examples of sexual harassment include sharing sexual or lewd anecdotes or jokes, unwelcome touching, including pinching, patting, rubbing, or purposefully brushing up against another person, repeatedly asking a person for dates or asking for sex, and making sexual comments about appearance, clothing, or body parts, among others. So all these things will be coming under sexual harassment. So that is the first one. Second is rape. You all know, I don't want to go into that because you all know that it is without the consent of the person. Then there is corrective rape also. So if the person is having a different gender identity or sexual orientation, so some societies, they will deliberately force the victim to conform to heterosexuality or normative gender by corrective rape. Then sexual violence in conflict. This is also very common. Violation of human rights in situations of armed conflict, like systematic rape, sexual slavery, forced pregnancy, forced sterilization, forced use of contraceptive, female infanticide, and prenatal sex. So all this will happen in conflict also. Then femicide. So I think few might be familiar with this word femicide. It is the intentional killing of a woman or a girl because she is a woman or a girl. This gender-related motivation may range from the stereotyped gender roles, because I told you unequal power balance or relation between men and women. Gender-based killings are very common. You might have heard in news also, honor killing, right? If the person is marrying somebody else, so honor killings are also happening. Then human trafficking. This is also very common. You might have heard it's a global crime when people are traded for profit or physical sexual abuse. It can happen in their own country, during migration, or in a foreign country. It takes many forms. All the people are targeted. Then this is a very serious thing, female genital mutilation. Few might be familiar with this. Refers to all procedures involving partial or total removal of female external genitalia or other injury to the female genital organs for non-medical reasons. Then it is female genital mutilation. It is often carried out on young girls between infancy and age 15, right? So in some cultures it is there, and if this is having no health benefits, it leads to long-term complication, and psychological effects is more, and the person may die also. Then child marriage, everybody knows it, under 18 years of age, if consent is not there, forced means no consent. Child marriage is a violation of human rights. Then online or technology facilitated violence. Technology facilitated violence against women is any act that is committed, assisted, aggravated by use of communication technologies. Online stalking, image-based abuse through artificial intelligence like deep fake videos. Online violence includes cyberbullying. So what is cyberbullying? When you send intimidating or threatening messages. Non-consensual sexting is sending explicit message or photo without the recipient's consent. Doxing, you might have heard. It is public release of private or identifying information about the victim. Cyber stalking, you all know, and it can be done through any of the, by using the technology via internet and electronic devices. Then now we will come to the abuse of women. So physical abuse include hitting, slapping, punching, kicking, burning, strangulation, damaging personal property, refusing medical care or controlling the medication, coercing partner into substance use, and use of weapons. Emotional abuse, name calling, insulting, blaming the partner for everything, extreme jealousy, intimidation, shaming, humiliation, isolation, controlling what the partner does or where the partner goes, stalking. Sexual abuse, I have already told you, it can be of any of the nature without the consent of the person. And technological abuse is hacking into partner's email and personal accounts, using tracking devices in a partner's cell phone to monitor their location, phone calls, and messages, monitoring interactions via social media, demanding to know the partner's passwords. So, as females, we should be very careful. We should protect the communication location, use phone cautiously, use computer cautiously, remove GPS devices from your vehicle, frequently change email passwords, clear your viewing history. So these are some of the ways by which we can protect. Then financial abuse, you all know, inflicting physical harm or injury that would prevent the person from working. So they will not allow the person to work because maybe she's having a job and the person wants to control. Second, harassing the partner at their workplace. They will go to their workplace and harass them. Third, controlling the financial assets and putting the partner on an allowance. They will give him money. Every month they will give something to the women and rest everything they will take. Damaging a partner's credit score. You all know credit score for bank and all, CIBIL score you have heard, and many things you have heard. So they may damage the credit score of the individual. So that is financial abuse. So this one slide I want to say that people in society don't recognize that if the mother and child is not bonded properly, they will not develop into a proper adult. So if the mother is subjected to intimate partner violence and the child is maltreated, and she herself, when she was a child, she was maltreated, or other violence she has encountered, or she has witnessed the violence, everything will have an impact on her adult development. Then I think I have told most about females only. So domestic violence against men also is common. So don't think that only women are being abused. It is common in men also. Maybe the severity is less, right? But aggression is there and cases have been reported. Physical abuse directed at men include slapping, pushing, hitting by wife, her parents, relatives, throwing objects such as utensils, cell phones, and crockery at the husband. Maybe it is not severe, but it is there. The most common form of physical abuse is slapping. So the severity of violence is less compared to the males, which is reported to be 98.3%, and the least common was being beaten by weapon that accounted for 3.3% of cases. Only in 1/10 of the cases, men reported their physical assault. Why? Because it is not very much encouraged that male should show their emotions. So psychological and emotional abuse against men encompasses criticism being reported against men. 85% were insulted publicly or in front of someone, 29%, and 3.5% were threatened or hurt. So it can be also in the form of a mental abuse, like constant threat to husband and family. So sometimes what happens, some females may take advantage of IPC section 498 of dowry and domestic violence. So because of that, what will happen? The husband and their family, they will be tortured and they will be having mental abuse. So they also may be suspected to mental abuse. Sexual abuse has been reported to be experienced by only a small proportion of men, that is 0.4% of men. So how to mitigate domestic violence? So domestic violence against men also. So we can provide resources, connect to the resources and provide programs, lawyers and other court services and create awareness. Third is elder maltreatment. So you all know about elder abuse. It happens to a person who is aged 60 years or older. It can happen in the home. It can happen in an hospital by the health workers. It can happen in the institutions where they are working. We all know that World Elder Abuse Awareness Day is on 15th June. Magnitude, around 1 in 6 people 60 years and older experience some form of abuse in community settings during the past year. Even if rates remain constant, the number of people who are experiencing is globally rising. Abuse of older people can lead to physical injuries and long-term psychological consequences. So this I have taken from WHO. So what is elder abuse? It is the abuse and neglect of older people. It takes many forms. Same forms are for them also. Physical abuse like hitting, pushing, kicking, giving drugs to them, restraining them. Psychological can be insult, threat, humiliation, confinement and isolation. Then sexual abuse, sexual contact without consent. And financial exploitation is most common thing. Neglect or abandonment means they may be left on the street without any food, housing or medical care. So often the people who commit elder abuse are in a position of trust. They may be the family members. For these children only they might have lived. And these healthcare workers for whom they have trusted, they themselves might be neglecting them or causing abuse. So health sector has a great role and responsibility in prevention and response. Elder abuse is a hidden problem. They won't say because they feel bad, because they don't want to bring shame on their children and their family, right? So it will be a hidden problem. So we have to identify and care accordingly. It can happen at home and institutions, I told you, but only 4% of elder abuse is reported. Can you understand why it is? Because they fear retaliation. They think that they may be left alone on the street. They worry about the abuser again will be creating more problems, and the person may themselves be incapable physically or feel ashamed or embarrassed. So all these are the risk factors for committing Elder abuse, like abusing alcohol, high stress level in the family, no social support, emotional or financial dependence on the older person. So if the person is not working, the family members are not working, so they will be dependent on the older people. Lack of training in how to take care of older people. So many times it happens that they are not equipped to take care of their sick old people. And if the person is having mental health problems. So older people with dementia are at particular risk. As many as 2 out of 3 dementia people, they have been abused, right? Because they will not remember. So types I have already told you. Then the fourth aspect which I am taking is the psychiatric disability. So first was child, second was the violence against women, third elder maltreatment, and fourth is the psychiatric disability, or you can say psychosocial disability. So these two words, psychology, you all know, and when they are viewed by society, how they are viewed by the society, and what society defines as normal. So it has a psychosocial component. So psychosocial disability refers to the social and economic impacts of living with a mental health condition. So like earning money, buying things, etc. So it challenges a person. It refers, psychosocial disabilities refers to a person who have a mental health diagnosis and who have experienced negative social factors, including stigma, discrimination, and exclusion. So you think, so these people will be more abused. People living with psychosocial disabilities, including ex-users, all these people may be abused, and it is most common among elders. Signs: low self-esteem, tearfulness, they will be crying, lack of eye contact with the healthcare provider, fearfulness, reluctance to talk openly, helplessness, insomnia. So this disability can be not only psychosocial, it can be sensory disability also, like being deaf, physical, like spinal cord injury, they're again dependent, intellectual disability, or psychosocial, which we are learning. So this psychosocial disability may limit a person's ability to be in certain type of environment. They will be afraid to go in certain environment or concentrate. They have enough stamina to do certain activities, or sometimes they may have more energy, cope up with the time pressure. They will not be able to cope up, interact with others, understand constructive feedback, and manage stress. So I have given in the left, you can see psychosocial disability involves actual or perceived impairment due to a diversity of mental, emotional, or cognitive experiences by the person, right? So violence is also common among people with disabilities. People with disabilities face 1.5 times more violence than people without disabilities. The perpetrators are often people who are known to them. It is estimated that 15% of the world population lives with disability. So you can see that if the person is disabled, along with maybe it is a physical disability or it may be a mental impairment, so violence they will be encountering more. Then the last, but fifth one is the substance abuse. So you all know the persons who are taking the substance, they themselves will be violent, right? And they will create violent conditions for others also. And they may harm themselves also as well as harm others also. So what is the connection between drug addiction, alcoholism, and violence? It crosses individuals. The individual is affected, the psychology of the people are affected, the public is affected, and domestic violence. So all these are involved. So substance use disorder is a medical condition, you all know. It is, in fact, research indicates that up to 75% of individuals who begin treatment for SUD, substance use disorder, report having engaged in physical assault, mugging, or using a weapon to attack another person, or other violent crimes. Statistics on substance abuse and violence. In 2016, alcohol caused about 90,000 domestic violence deaths worldwide. Alcohol or drug use is used in 40 to 60% of domestic abuse situations. More than half of the individuals who abuse their elder parents. So you can see alcohol plays this is a data of the United States, which shows that alcohol plays a role in 32% of all murders, right? So you can see traffic injuries, that is also common. The other person is driving okay, but the person who is under the influence of substances, they may cause traffic accidents also, right? Then drug use like methamphetamine, for instance, the people may suffer from anxiety, confusion, insomnia, etc. So they also cause hallucinogens. They are hallucinogens which may create hallucination for the individual. And you can see that one data, between 25 to 50% of men who commit acts of domestic violence also suffer from substance use disorder. So this is the point where it intersects with each other. So suicide also more common among the heroin addicts, right? So you can see that there is a definite correlation between suicide and substance abuse. And crime also, if you see, it is closely associated with substance use disorders. So research suggests that among present population, alcohol abuse and dependence were found to be 18 to 30% in men and 10 to 24% in women. Sexual assault, I have already told you. Then now the last topic. So I have 5 minutes, madam, more. Can I take 5 more minutes?
Yes, ma'am.
Okay, thank you, ma'am. So the last part of my topic is occult religions. So occult is what? Occult is something which is mysterious. And we all are finding out what is mysterious in this world. So there are certain occult. So some people will have certain groups and they will believe something and they will believe, and there will be followers who will be following them. And there will be ritualistic violence also. They will follow some rituals and they will practice violence also. Most, not if all, occult and paganist religious practices are protected by First Amendment. In many cases, Satanist also is a group. So juveniles, delinquent people, they call themselves Satanist so that they can rebel against the society. And they will do all those things which are against society. So meaning of occult, beyond understanding, or mysterious or relating to supernatural forces. There may be ritual murders. You might have heard many women or many children, they are burned alive or killed so that they will become rich. So under the influence of certain people or religious people or godmen, what they will do, they will say, you kill this much people, you give belly so that you will become rich. So there may be ritual murder, there can be black magic, occult practices and witchcraft. And Tony, you all know about that, no? So witch hunting was common in India also as well as in foreign countries. India is a land of magic, tantra and occult. So witch hunting and occult practices where women were forced to, they were thought that these people were evil and they were burned. Then religion and violence. So you all know, you all read newspapers. I don't think I have to go into detail into that every religion has faced difficult violent situations in different phases of history, right? It includes acts of violence by followers of one religious group against followers of another religious group. Usually it happens between Hindus and Muslims, but other religions are also targeted. So Gujarat communal rights, you can read and you all know it also. Anti-Sikh rights, where it was on Sikh population. Then anti-atheist violence was there, in which Narendra Nayak, who propagated or advocated atheism, right? So he was also targeted, or his group was also targeted. Then anti-Christian violence that you are hearing, right? In Graham Staines, you have heard, right? So different phases, different people have, or different religious group have encountered violence. Even anti-Hindu violence also, right, has happened in Chamba massacre or Fidyain attacks, or many Godhra train burning. So all the people have encountered violence. So, but we are not bothered about religion. But why I am telling you this is that people may come because of anything, of any of the factors which I have told, maybe because of occult. So as a nurse, we should be able to identify whether it is due to what factor it is there, this violence is happening, and how to deal with it. And our part is to give trauma-informed care. So trauma-informed care is what? It is an approach based on the principles which are introduced by Substance Abuse and Mental Health Service Administration, which is known as SAMHSA 2021, which focus on 4R. First R is you have to realize there is a trauma. You have to realize the effects of trauma. You have to, second point is you have to recognize the signs of trauma. Third, you have to respond by giving them patient-centered care, safety, transparency, dignity, and emotional support. And fourth point is preventing re-traumatization. So when they come to the healthcare setup, we should not again give them trauma, right? So we should prevent re-traumatization. So that is known as trauma-informed care. Okay. So I think, madam, somebody will be dealing about role of forensic nurse. So I'm not going into details. And we have more experts. I think they will be dealing with all those topics. So we have to think of equality. So when equality is there, there will not be violence. So that is the best thing. Everybody should be given their rights. So non-violence we can practice. And if equality is there, power and everything, there is equal powers are given to all the people, then there will not be violence, right? And we can provide support by maintaining the safety of the victim. You have to provide legal consequences to the batterer. Who is batterer? Who does battery or who harms the individual or who is a perpetrator. Addressing emotional impact on the victim and problem abusers of alcohol and drugs. So conclusion, violence is preventable. Violence is not an inherent part of human condition. It can be predicted and prevented. So we have to have interventions at individual level, close relationship, community, and societal levels. Intersectional approach is very important because every different layers are affected. So the government should come together, work together, build a system so that we can cut across all the areas, counseling, advocacy, and retail resources. And we should involve non-profit organizations, and government support is needed to combat. So one thing I want to tell you, so if whatever is happening, people are affected. The center, you can see mother and child is affected. And if the child is affected, it can be a male child, it can be a female child, or it can be any gender child. But the child, when it grows to an adult, it has a harrowing experience in their life. So trauma is very bad. Violence is very bad. So we should avoid it and we should provide support. So I will end by two quotes. First by Patricia Cornwell. I didn't invent forensic science and medicine. I was just one of the people to recognize how interesting it is. Unquote. By Archana. Fingerprints are not just for grabbing things, but they leave their mark on them. So let's leave good fingerprint in this world so that we can provide good care to the patients. These are my references. Any questions? I hope it is clear to you. I will share the
Yes, ma'am.
PowerPoint.
Okay, ma'am. Ma'am, one query from the participant in chat box that can you explain the slide number 53?
Yeah, 1 second. Okay, I didn't go into much detail because of time lag. So when abuse happens, what happens? So first there will be a situation in which the person has harmed a person, right? So it can be an abuse, it can be verbal, it can be a physical abuse, right? Leaving the victim to be wounded physically, right? And emotionally. So now what will happen? The person who is a perpetrator, you might have seen movies also, right? The husband may beat the wife and then again take him for movies or give her flowers or chocolates. And I will say, sorry, I will not do it again. So that is honeymoon phase, the second phase, right? So then what happens? Again, some situation happened in the house, some conflict happened. Again, the person became tensed and the person again beat the person. Clear? So this becomes a cycle of abuse. So we have to break this cycle. So by either creating awareness, right, or to take proper action or empower the individual, or the betterer should be taken care of and the legal consequence should be made understood to the person, right? I hope it is clear to you. So abuse should not be tolerated. Abuse has to be stopped. Whenever you see abuse, you have to take an action, right? You should not tolerate abuse. You should not abuse others. I hope it is clear.
Yes, ma'am. Thank you, ma'am. Thank you so much for that profound and informative session on addressing interpersonal violence. Your insight into the complexity and challenges of critical issues have deeply impacted to us.
Thank you, ma'am.
Thank you, ma'am.
Thank you, Alka, ma'am. Thank you, Binu, sir, and your management for giving me an opportunity.
And everyone can clear their doubts. Thank you so much.
Shall I leave,
Now,
ma'am?
yes,
I
ma'am.
have another appointment. Thank you
Okay,
so
ma'am.
much. Thank you so much.
Thank you, ma'am. Now, as we moving today's next session, which is on public health and safety. For that, we have an eminent speaker, Dr. A. Maria Trishi, ma'am, professor at College of Nursing, Mother Teresa Postgraduate and Research Institute of Health Science, Puducherry. Ma'am has completed PhD nursing and having 30 years teaching and 15 years research experience. Ma'am has organized certificate course on advanced nursing, leadership and management, international certificate course on principle of bioethics and human rights by UNESCO, chair bioethics Haifa Department of Education, and various seminar, conferences and webinars. Ma'am has presented more than 30 papers and ma'am got award for the outstanding teacher by Research India Foundation, Best Teacher Award by NTI, that is Nursing Teacher Association of India, and Excellence in Research by Mother Teresa Postgraduate and Research Institute of Health Science. Over to you, ma'am.
Thank you, Ms. Bhavana. Am I audible?
Yes, ma'am.
For the great introduction. At the outset, I would like to thank the great organizer for having me given this opportunity, especially Dr. Binu, Dr. Alka. Thank you so much. So let me share my screen. Is it visible to all?
Yes, ma'am. Can you please do slide share?
Yes, slide share only.
Okay, it is visible.
Okay. Okay, the topic which is given to me is public health and safety, which is related in regard to forensic nursing. So as just I have coined the word because we, the forensic nurses, are playing a great role in taking care of the victims. So behind the scene, our work has to be talked worldwide and also in the publicly. So behind the scene of the forensic nursing, public health and safety. So this 41-hour session, I would like to cover up the environmental hazards, whatever they are facing, the forensic nurses are facing towards, and food and drug tampering, illegal abortion, epidemiological issues, and tissues and organ donation. As you all well known about forensic nursing, it is application of nursing science. So nursing science, it is rendering the health to the individual for the promotion, prevention, and restoration of the health. That is what it does mean, the nursing science. And this nursing science is going to incorporate with the legal proceeding and application of forensic healthcare in scientific investigation during any trauma scene. That means any death related or to abuse violence, criminal activity and liability or any problems which will be taken place to the public or to the general society and due to accidents. So I can say that this forensic nursing as such, it is a blend with three components of nursing and legal system and science. So here, who are the forensic nurses? What I want to say is that, so here forensic nursing, it does mean that we need to, what, am I audible? Am I audible?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay. So here, the forensic nurse is a professional who works with the crime victims who are abused or when there is any perpetuation or the crime victims to gather medical evidence. So this is the main role of our forensic nurse and provide expert testimony. That means we have to be a somewhat expert witness. We should act in some of the situation as such that can be further used in a court. So forensic nurse can become a registered nurse and also a specialized in nursing education. So here, apart from giving physical healthcare and emotional healthcare and psychological nurse healthcare, the forensic nurses are playing a vital role in collecting the evidence and providing suitable medical witnesses or medical testimony in the court of law. And we, the forensic nurses, are a consultant with the legal authority. Here, sometimes, in some situation, there may be arising where we can, the forensic nurse have to act as advocate also, and with the legal authorities, and perfect professional for forensic roles, and work with many kinds of the people, because that is what called as intersectoral bond. So we have to integrate with other professionals or other disciplines for the betterment, for providing a better care to the victims, those whoever is been affected with some of the incidents or accidents. Okay, so normally what do they do? What the forensic nurses are doing is, main thing, they are investigating all the documents and injuries. So whenever they happen to come across some injury or some accident or assault, it is the held responsibility of the forensic nurse to document or examine the injuries and providing trauma-informed care. Just now, madam was taking that samosa, that 4 hours. So that way we have to have all the responsibility while providing the trauma-informed care, including psychological and physiological and examination of affected victim, everything we have to take care of physically, mentally, and socially too. And conducting sexual assault examination, it is very important that, because when the person is sexually attacked, we have to have the physical examination technique, the skill we have to develop. For example, in a genital examination and taking up the swabs and send it to the laboratory investigation, where we have to have a good play on sexual assault examination and testifying in the court, as I told already. So here what we are acting as an expert witness. So collection of the evidence and sending to the court for the further investigation. Here we have to testify. So here we can act as an expert witness, and the evidence also has to be proved for the betterment of a good solution, and developing the policies and protocol in this. It does mean that the forensic nurses have got a right to contribute the policies and protocol along with the government also. So what should be done, what cannot be done. So what are the standard rules has to be provided in such a manner where the forensic nurses are playing a vital role and educating the communities. So here the forensic nurses making the people to be aware of. So what is the situation which has been taken place, how it has to be rectified, and what are the evidence, how we have to make an evidence, how the safety measures to be taken by the society or by the individual has to be disseminated through the forensic nursing education only. And collaborating with the law enforcement, that as it was been already mentioned, that along with the nursing strategy, we have to go along with the law enforcement for making some decision, for making some evidence too, and advocating for victims' right. It does mean that the forensic nurses, sometimes or in some situation where we have to support the victims, what is their rights, what are the victims' rights, because some of the legal statement may not be aware of, so in such a situation, the victim, those who are affected in a particular situation or particular event, So they need to be explained as we are support the forensic nurses are being supporting to the victims also. So these are the normally, generally, we the forensic nurses are expected to do. So with regard to environmental hazards, so as forensic nurses are making or playing a vital role in many components and many aspects also. Here, the forensic nurses, as when the forensic nurses are giving care or taking care of the victims, whoever is affected, encounter various environmental hazards, environmental problems when investigating the crimes, collecting evidence and caring for the patient. So let us see one by one. What are the, because the environmental is polluted with air pollution, soil pollution, water pollution, and radioactive. So in such a situation, for example, when some situation, when unwanted thing taken place, so there is a chance for the forensic nurse as well as the individual who has been affected also exposure to some of the hazards like water hazards, for example, air hazards. So gases, there may be exposure of gases which may contain some toxic substances like sulfur, nitrogen, carbon, and oxygen. And also some water hazards, industrial, because nowadays, even in the newspaper every day, there may be some of the news which will be taken place. We can see easily due to what are the hazards which is being affected by the society is being affected by these hazards, environmental hazards like industrial waste, domestic sewage, and thermal radioactive, and soil hazard in the sense there may be a landslide. This is when there is a landslide, there may be a chance for the health or safety has been affected, and also radioactive hazards. And when there is some exposure to cosmic radiation and production and research of nuclear weapons, these are some of the environmental hazards which might be expected to be causing some unsafety situation, and even it will cause some ill health problem to the society as well as the healthcare personnel. And some of the other environmental factors or biological hazards. For example, as the forensic nurse or the forensic team as such, the forensics team will include all the forensic physician, the medicine, and all the legal, and everybody is there. So about the forensic team. So when they expose themselves, there may be a biological hazard. For example, bloodborne pathogens. There is a chance to touch the infected blood and bodily fluids and infectious disease. And chemical hazards in the sense there is a chance for toxic substances like drugs, poisons, and chemical weapons also. And coming to physical hazards, there is a, for example, for physical hazards or sharpened objects like needles and any broken glasses and heavy object or debris. These are the materials which are coming under physical hazards. And as I told already, radiological hazards, when the persons are being exposed, there is a chance for the public or the society or the individual to expose into the radiological hazards. For example, any nuclear material and medical equipments. So these are the examples of radiological hazards. And psychological hazards in the sense, there is a chance for any injurious or traumatic events or any scenes, or even a person even verbally threat also or physical attack also. These are the coming under your psychological hazards. And coming to environmental hazards at crime scenes, which means there is unstable structure or surface in that particular area where exactly the unwanted or accident or attack taken place, and there is a chance for poor lighting and ventilation. When there is a poor lighting and ventilation, may not be able to collect the evidence or even may not even find out the surface also. So these are some of the environmental hazards in the crime scene. Normally, the people will come across those who are involved in the forensic science, or especially in forensic nursing. And environmental hazards in healthcare setting, as told already. So here there may be, because all the resources may not be available. So here there is a chance for getting infection also. So inadequate infection control and poor ventilation and inadequate safety measures. For example, there is a lack of provision of PPE, personal protective equipment. So these are some of the environmental hazards where the health personnel as well as the affected victim may come across under environmental hazards. So how to ensure the safety measures against environmental hazards by forensic nurse? So here the forensic nurse plays a crucial role in ensuring safety measures against environmental hazards in various settings like crime scenes, health facilities, and communities. So first thing what we need to do is risk assessment. So assessment has to be what is the potential. So as a nurse, we have to identify what are the potential risk which is being encircling there in that particular area, and also assess the level of risk also. So first point. Second one, personal protective equipments, where here you have to ensure that the use of appropriate PPE, for example, gloves are available or masks are available. The eye have to be protected. Some of the, in case of any air pollution, air hazard, the eye also has to be protected. So whether these equipments are available, that has to be ensured by the nurse. And infection control. See to that, implementing proper infection measures also to be to prevent further spread of infection has to be maintained. And evidence handling, it is very important. For example, here, proper handling and packing of the evidence, because there is a protocol to handling the evidence and how it has to be making a package, and it has to be sent to the laboratory. So this is the very important thing the nurses has to notify for securing the contamination or evidence. And next one is scene safety. It does mean that whether the area where there is a talk taken place or the the crime scene is safe for investigation, including the securing of the area and identifying the potential hazards has to be ensured, or it has to be observed. And coming to decontamination, what is the meaning of decontamination? Any idea? So here you have to ensure the decontamination procedure. I know that I think you people must be the students.
Sterile.
Student nurses are well versed, know about the decontamination. What are the measures? The hand washing, the cleaning, and the sterilization, washing. So whether these they are properly maintained. So that this is also one of the safety measures against environmental hazards. And policy development. As I told already, here we have to maintain the policies because it has the policies. So the nurses, the forensic nurses are expected to know about the laws and act of forensic medicine, and thereby you can make along with the stakeholders where you can have a policy development so that the standard protocol has to be maintained in order to follow the safety measures against environmental hazards. And community education, as I told already, what you have to do is so you have to educate the community, the society, the community in the sense it's a group of people. You and me is a community people. Okay, so here you have to ensure the community on the environmental hazards and the safety measures as a proper, for example, how we have to properly dispose the unwanted thing. Proper disposal or of hazardous material has to be explained properly. And collaboration, it is an integral approach. So where you have to work along with the law enforcement, advocates or law enforcement, and along with some of the educational, environmental agency and other stakeholders to ensure that comprehensive approach to the environmental safety is ensured. For that, we have to go. So here what we can do is the integral approach has to be followed. And what is the meaning of incident response? It does mean that the responding to environmental incidents. So what does it happen? What did it happen? When does it happen? So what is there any chemical spills? Is there any chemical spills? And also what are is there any natural disaster? Or that and all has to be responded by the forensic nurse, and ensuring for which we have to ensure the safety measures. Again, what are the safety measures are at present existing? What else has to be done? So that has to be clarified for the forensics now. This is how we can ensure safety measures against environmental hazards. I know that what are the environmental hazards faced by the forensic nurse and the society, and what are the safety measures to be taken care, to be followed to rectify all these environmental hazards. I think you are well versed in that. You are clear about it? Okay. Now here, so as I told, generally, this is what the role of a forensic nurse. For example, especially suppose one victim is affected or exposed to the particular environmental hazards, how we can, what is the protective measures or safety measures we need to follow is that first thing you have to assess the scene. For example, evaluating the environment, that is potential hazards such as chemical spills or radiation, that has to be assessed in order to protect the victim. Victim in the sense, the person who is affected, the individual, okay, or a group of individual who is affected with the particular accident or particular event. And ensuring the safe transport. This is very essential. Here, the transporting victims in a safe location away from the environmental hazard. It has to be taken care by the forensic nurse. And as I told already, providing personal protective equipment also has to be provided to the victims also. And decontamination, the washing, that technique also has to be followed. And medical evaluation, it does mean that the person who are, the victims who are affected with a particular incident has to have a perfect medical evaluation to identify the potential environmental exposure and providing accordingly the treatment has to be provided. And next thing is, it is very important again, environmental sampling. It has mean that you have to collect the environmental sample as such, the air, how does this explosion or the situation taken place, whether it is due to air pollution or water pollution or any other material or nuclear thing or radiation. So this has to be identified and the samples has to be collected properly to assess the hazardous equipments, okay, substances. And victim advocacy, as I told already, here we have to act as a we have to act as a supporter, advocating the victim's right and ensuring their safety and well-being is very essential, which has to be taken care by the forensic nurse as such. And collaboration with the authority, as you know that, and providing emotional support, which is essential. So here you have to offering emotional support and even counseling also can be offered to the affected individual. And documenting evidence, it is very essential. It is very, each and every concept has to be documented. For example, documenting what are the things you will document is that what are the environmental hazard which is been existing and how the victim has been exposed. And here you can even collect some photographs or videos or some written reports to support the investigation and legal proceeding also. So this is how you have to do the documental evidence. And developing safety plans, as such, you can say creating the safety plans. Already you can make some protocol along with including evaluation forms also, and you can make some with some criteria, even you can make some evaluation report also. And educating victims also has to be carried out. So these are the technique, these are the strategy where you have to follow while you are protecting the victims from the environmental hazards. And how to, because we the personals are always with the patient in a affected area. In such cases, it is essential for even we have to protect ourselves. How we can protect ourselves? As I told already, it is a risk assessment has to be made, identify the potential environmental hazards, and developing safety protocol, training and education. It is very essential because the forensic, the health personnel have to have up-to-date knowledge with regard to what is existing. Everything has to be obtained. Health personnel and safety measures also has to be educated and trained. They are advised to have some training, even hands-on training also they are advised to go for. And ensuring proper PPE, exposuring, monitoring. It does mean that monitoring the health personnel for potential exposure to environment hazard and providing medical treatment and medical evaluation is essential. So when the health personnel is exposure to some event, for example, some environmental hazard, so they are taking some they have to be monitored very carefully, and according to the signs and symptoms, the treatment has to be provided. And the incident report responding to the environmental incidents such as chemical fields and environmental hazards or environmental safety has to be ensured. And as environmental sampling also and collaboration with infection control in order to prevent further spreading of infection, they need to take care of that. And developing emergency response plans. It does mean that you have to make a emergency response plan for environmental hazard and what are the evacuation procedure, how we can get away from the situation. And with this procedure has to be known by the forensic nurse. And also so only that this also drill and all, which has been everywhere in every colleges, it has been practicing. And emergency contact information. So they should have the emergency contact information at their hand in such situations. Okay, and see to that, we have to ensure the proper ventilation, proper lighting facility, and proper ventilation has to be reassured. And disposal of hazard, how this is a technique where some hazardous waste, how it has to be disposal. That also has to be carried out, or by any biological waste, how some chemical waste would be there, how it has to be disposed. That also should be known by the forensic nurse. And compliance with regularism. So this also has to be followed by the forensic nurse. Safety measures for health personnel. This is how we can protect ourselves. That means the health personnel to safeguard ourselves. Okay. Then here you can just go through health and safety at the crime in any crime situations. So if there is a fire situation, what are the strategy we have to follow? What are the steps we need to follow? Seek advice from the fire service and never enter alone. Falling debris, damage, asbestos, weakened surface. So see, these are the things have to be observed. For example, in case of road traffic accident, high visibility clothing, using camera, someone to watch back, split fuel, sharp, anything has to be there. And these are the measures in how to take care of the risk assessment, step-by-step consideration of the situation. So every step, how we have to follow. And these some of the act with regard to health and safety at the crime scenes, we have some of the act and regulation. For example, Health and Safety at Work Act and PPA Act, Chemical Act. And in case of violence at the skin, control of CSI must know where they lie and means of contacting, control, and self-defense training. And in case if they come across any sharp instruments, how to protect ourselves, gloves, goggles, remote device to pick up the needle sharp. So these are the measure, these are the intervention, or these are the strategy where we can follow. If we follow as a forensic nurse in any situation of a crime scene, so this is how if we follow these strategies, these steps, so definitely our health and safety also has to be maintained. And coming to next topic, this is one scenario which I want to tell. Recently, I think in 2 weeks back, there was a case. Students of an engineering college in Bihar, Banco, have alleged that a dead snake was found in food provided to them at the college canteen. I think you all must have heard of that. According to the students, at least 10 to 15 of them were hospitalized after alleged consuming the contaminated food. The students said that they developed symptoms like nausea, vomiting after eating food from the canteen on Thursday night. Later, a small dead snake was found in food, which was provided by the private mess. So this is what a scenario which we have come across 2 weeks back. It is all over. So what is that called? So here, what I found is, it is an intentional or non-intentional contamination or alteration of food products with the intention of causing harm or illness to the consumer. Here, some alteration of the food has been taken place, which caused some of the harm or illness to the consumer, those who have consumed that particular food. So what is the term called as food tampering? So now we must be understanding about what is food tampering. This is also very important to know about food tampering. So what are the remedies? What are the measures to be taken care of in case if some person affected with that? So what is the solution we have to follow with regard to forensic nursing? So there are some of the types of tampering, food tampering, physical tampering, biological and chemical and economic. So what do you mean by physical tampering? Adding some harmful object or substances to food, such as glass, metal, harmful chemicals. And biological tampering in the sense, some bacteria or virus or the other into the food. And chemical tampering, as such, you know that some chemical substances are be mixed with the food items. And economical tampering, altering food labels, even labels, the false labels where we can see, and package ingredients also. So these are some of the types of food tampering. And here, what will happen if you consume these items without our knowledge? If we consume, so it is ultimate harm to the society, harm to the individual. How does it affect? Foodborne illnesses and poison. There may be a AGE and diarrhea, nausea, vomiting. Even we may lose the life also. Economic losses, food manufacturer and distributor, and loss of consumer trust will not be there from the consumer. This and confidence also will be declined, and legal and criminal consequences for the responsible. So what action to be taken for? Generally, what action in case if you found that any food tampering, general action. So it is not only the forensic team where they have to do some measures. It is ultimate responsibility of the entire society. So generally, what are the action to be taken care by the implementing secure food handling and yes, anything? And conducting regular food safety testing also, which is very important. And see to that it is be aware of food recalls and safety alerts. And it is very essential. We, the ultimate general population, also should know about and reporting any, if there is any suspicious taken place, it has to be immediately reported to the concerned authority. This is not only the responsibility of the person, those who are involved in the forensic area, forensic science, but see to that it is a general responsibility of the public. And here where the role of a forensic nurse in food tampering is, first thing what we have to do is collecting and preserving the evidence. Here, the forensic nurse help to collect the and handle the physical evidence such as contaminated food sample has to be collected and it has to be packed in a proper container or the utensils, and you have to maintain the chain of custody. So here you have to maintain the chain of custody. There is a process of preserving the evidence and conducting the interview, which is very essential. The forensic nurse, so she has to go to the site and make an interview with the victim, those who are affected, and witnesses also. She has to make a interview with the witnesses and the suspect to gather some information about the incident, including the symptoms and what are the food consumption has been done, and potential suspects also has to be interviewed. And providing medical care, as you know that those who are is affected, so he has to assess and treat the victim of food tampering according to the symptom based. So medical finding and collaborating with the investigator, that is means, so he has to go along with the law enforcement and public health officers and food safety expert to investigate what is the source, what is the scope of this tampering has to be identified when you are collaborating with the investigator. And analyzing the evidence in the sense, the forensic nurse may assist in analyzing the evidence. What is the exact toxicology reports or any DNA testing has been done? What is the main ingredients or exact chemical substances are being involved in that particular food item? So it has to be analyzed and to determine what is the nature and extent of this tampering. And again, developing the policies and protocol, what she has to create the guidelines and procedure of responding the food tampering incidents. For example, including the emergency response plans and victim support services also to be included. And of course, educated. So the public has to be aware of, make the people to aware of what are about the consumer, how the food has been, the food handlers and healthcare professional about the food safety and tampering risk and prevention strategy also has to be educated to the public, not only to the public, the food handlers, and also the healthcare professional also to be educated. And testifying in the court as the witness or in the expert. So the forensic nurse may provide a forensic, the testimony about their findings. So what exactly is being found out in that particular site has to be transformed to the testimony. For example, how the evidence are being collected, and what was the findings, what are the medical treatment has to be carried out in a criminal or civil cases also to be identified with regard to the food tampering. These are the things this is what a role of a forensic nurse in drug tampering. And food tampering. And coming to drug tampering, it is also a type of so this is again last year it happened in Tamil Nadu. It's a nearby village. A boy aged 13-year-old was studying in 8th standard in a private school. He was the topper of the class, both in studies and sports. Very smart boy must be. His classmate, a girl of his same age, was a little bit weak in her study, and hence their friendship was not smooth right from the beginning. The girl's mother was very envious of his progress in studies and slowly developed a hatred for him. This hatred ultimately, after reading the scenario, you must be wondering, how does it happen? Led her to administer. So this hatred immediately led her to administer a rat paste administered in a RTS, ready to serve beverage to the boy, which eventually entered his life. This has happened. Additionally, it was after the forensic investigation, it was found that 6-block colored tablet of Jolox. Jolox in the sense it is some kind of laxative, okay, were dissolved in the drink and given to the boy. This is what. So this is what happened. So this is how that drug tampering has been taken place. So this is again intentional alteration and contamination of drug or pharmaceutical product with the intention of causing harm for that lady. It intentionally has done for that boy, causing harm or illness to the person consuming it. So this is what drug tampering. So here there are 4 types. Counterfeiting, it is creating a fake or imitation drugs that may contain harmful ingredients and incorrect dosage. This is also a drug tampering. And alteration, adding harmful substances. Here, alteration only taken place. Altering the chemical composition of a drug to the boy, alteration taken place. And the third type of drug tampering is mislabeling, changing or removing the labels to conceal the true identity. It is also one of the crime, actually speaking. And diversion, it is a redirecting drugs from their intended use and user, such as stealing prescription drug for illegal sale or use. This is what I don't think normally in some occasion we happen to come across this diversion of drug tampering. Okay, here what is the consequences would take place? So when this for drug tampering, ultimately it will spoil the health, harmful to the health, including poison and death also, and ineffective treatment. So sometimes may not able to even treatment, the most treatment is being given, but may not be able to save the life of the person. So this is gradually that will be worsening the condition also, health of the individual also. And economic losses of pharmaceutical companies and erosion. So ultimately, we lost the trust of the individual or the trust of the confidant. So here, what is the role of us, a forensic nurse? So here, I can say that we the forensic nurses should have one more eye. So all the 360-degree have to be observed in the 360-degree state of observation has to be made by the forensic nurse. So here, collecting and preserving the evidence the forensic nurse will collect and handle the physical evidence such as the package, tampering drugs package, pills and syringes has to be collected, and conducting medical evaluation and identifying suspicious cases, in the sense she has to recognize and report the potential drug tampering to the unexpected drug reaction or unexplained patient, some unexpected syndrome also the patient may develop, the victim may develop when the drug tampering taken place. So these are the specific items has to be identified and it has to be reported immediately. This is what, and collaborating with the investigator and work with the law enforcement, analyzing the evidence. It does mean that the drug samples and package to determine the nature and the extent of tampering has to be analyzed, and developing on policies and protocol and educating the healthcare professional, which is very important, especially for a healthcare professional has to be educated about the drug tampering. How often, what is the method of making a drug tampering, how it has to be identified, and how you can identify the suspicious cases has to be taught to the healthcare professional, and testifying in courts. So whatever we have observed, it has to be testimony to the court law enforcement, and supporting the victim and families also. Here, it is very essential because emotionally they would be very upset. The family members also has to be supported, and some psychological support has to be, emotional support, and some of the resource to the victims and their families, helping them to cope up with the trauma and what are the consequences of the drug tampering. So this also has to be explained to the victims, and main thing, supportive system has to be administered to the victims and the family members, and participating the multidisciplinary team. That means along with all the other stakeholders or the regulatory agencies to address drug tampering cases, and develop what are the strategies for prevention and prevention of this drug tampering has to be maintained. Okay, up to this, I think next topic which I want to say is it is a legal abortion. So illegal abortion, it is refers to the abortion. So without any medical concern, with a violation of the law, so the abortion, the expulsion or is being taken place, or the fetus. So illegal abortion refers to an abortion that is performed in violation of the law or outside of the legal framework. So legal will not come under here. Any without their knowledge, out of their own, they may have a expulsion of the fetus. So why it is very common? Why illegal abortion is very common in India? Main thing, statutory rape. That means having intercourse with the minor people, minor age, small children, and incest, having intercourse or pregnancy which result from relationship with a close, very blood relations, very close relations. And sexual assault, it does means without the consent of any individual, making a pregnancy will happen like. And human trafficking in the sense by force or exploitation. So this is how the pregnancy may result. And forced marriage. Now, forced marriage without the interest of the pride or groom, because of the force of the parents, or some somehow the marriage taken place with the force. So these are the main reason for having a illegal abortion nowadays in India. So which way they are doing it? Illegal. So some people know self-induced abortion. Self-induced abortion in the sense, but willingly, even myself, the same individual as is willing to abort the fetus. Maybe they use with the untrained person, they will go and approach untrained person, or some medication they used to have. The mechanical violation in the sense, they will put the pressure over the abdomen, thereby the contraction would be more, the uterine contraction, and the pelvic organ also will be contracting, so that there will be, intentionally there will be a bleeding. So it is mechanical violation. And abortifacient drugs, for example, mifepristone and misoprostol. So this, even the teenagers, they know the ways and means of getting abortion nowadays. It is really a shock to hear this. So this medication, and since some herbals they induce, they will take, thereby the abortion, illegal abortion would be. So this is how the self-induced abortion are being taken place. and abortion performed by the unqualified and authorized person, and legal gestation limits under without any proper medical supervision they normally do, and abortion in a country or state where it is restricted or banned. So these are the areas where it is called illegal abortion. This illegal abortion is really a life-threatening procedure. As you all know that there are many, as per the statistics, 50 million per year are dying due to this illegal abortion, the maternal mothers. So it has to be very taken care of that. So what are the key aspects of forensic investigation in legal abortions are? Autopsy findings. First one, uterine examination. So as a forensic nurse, inspect the signs of recent pregnancy and any trauma or any, because without medical advice, if they by self-induced abortion, there is a chance even for uterus to get perforated. So there may be a uterine bleeding. So it may lose a lot. There is a chance to lose a life also. So these are the things uterine examination has to be performed with the whether they have used any sharp instrument to expel the fetus, unwanted fetus, and infection indicators. So here, these are some of the signs like sepsis, pus formation or inflammation or abscess of the pelvic region. So that also has to be found out. And internal organ, check the damage of the internal organs like bladder and intestine. There are many events, many incidents are being taken place during an unsafe abortion. So here, what is the role of a nurse as such is, so here forensic examination, collecting the evidence, and here genital examination also, which is very important to carry out, and documenting injuries, wounds, and other physical findings. So here providing, so when we talk about the role of forensic nurse, think of 360-degree observation or the findings. So here providing expert testimony in court and collaboration with the other law enforcement, participating in death investigation and autopsy here also. So what in autopsy also, the uterine, everything has to be assessed or in checked, identifying and reporting the suspected cases and assist the infection of the investigation, the healthcare providers, illegal abortion, and you have to help to identify systematic issues advocating. So here you have to, what is the issues will maybe arise, how it could be, what is the remedy for that, and how we can, so here you can make some of the supporting system also to the affected individual for the future maternal death, to prevent future maternal death. So these are some of the important role of a forensic nursing when you come across any illegal abortion. And coming to next one, epidemiological issues. What is epidemiology? As you know that, so it is a study of distribution of determinants of health-related issues or events and population and application of this study to control health problems. So forensic epidemiology uses a public health method in potential criminal investigation. So any health issues taken place, the forensic epidemiology, you have to find out what criminal investigation has to be carried out to find out what are the other health emergency. For example, now recently we have experienced COVID-19. So this is, so here why there is a more death, what is the evidence being collected, how it has to be examined, what is the number of diverse crimes ranging from environmental to foodborne offenses. So everything has to be clubbed together in forensic epidemiological study. So here, forensic nursing intersect in epidemiology in various ways of addressing some of the issues. So here, first thing, what injury surveillance, the epidemiological issues, and what is the role of a nurse. So with regard to injury surveillance, you have to see the surveillance observation has to be made and tracking pattern, which are the areas where there is more cases of particular conditions, or what are the any violent injury has taken place, or gunshot wound or domestic violence are being taken. So if you find this incident, then make a surveillance for that particular incident as such, injury surveillance. And next one is sexual assault and STD prevention, STI prevention, sexually transmitted infection prevention. This is also one of the epidemiological issues, which is very common here. And in such cases, provide care and collect evidence in sexual assault cases. Also, already Madam has taken. And addressing the epidemiological of sexually transmitted. So what are the cases? So number of cases, So under sexually transmitted diseases, what are the other cases? Some classes are there, and that has to be identified, and accordingly treatment has to be given. And intimate partner violence, homicide, IPV. So here this is again identify then what is the main cause for IPV and what are the risk factor or any homicide, what is the cause, how does it happen. So these and all where you have to get an information data, and if that particular incident would take place, collect the evidence, then get the transportation, and the evidence has to be, and accordingly you have to treat, and testimony has to be given to the legal authority. And coming to suicidal prevention, so in the particular, what are the suicidal rate and how it had to be prevented? What is the cause for suicidal rate? May encounter suicidal individual in the emergency department or psychiatric setting, applying epidemiological knowledge to inform the prevention. So from that sources, whatever we received the source, from that we can identify, we can even frame, even we can develop what are the preventive strategy or solution can be made. So that can be incorporated along with other stakeholders, along with other healthcare personnel, so that in the preventive aspect, we can work on it. And drug-related death and overdoses. So here, if any situation where it is happened due to drug-related death, so where the nurse, the forensic nurses investigate the drug-related death, what is the cause, which drug causes, whether there is any overdose, or inform to the epidemiological studies and substances abuse and overdose trend. Here today, it is a special day where we are observing International Drug Abuse Day. Say no to that. The theme is say yes to life, say no to drug. So here, this is also a kind of the strategy which has been with regard to epidemiological studies. Okay, so here so this is how we can find, because this would have been identified, the theme would have been identified by studying of all the epidemiological study which has been made by the forensic nurse in a particular situation of drug-related death overdoses. They would have investigated and found out that there is nowadays the drug abuse is more common among the elders. So we can in order to prevent such situations, such complications, such scenario, why can't we observe, so that everybody, this is also one of the preventive strategies, so that everybody, every society is aware of drug abuse. So what is the consequences of drug abuse can be dealt easily. And elder abuse and neglect. So here it is again. So as a forensic nurse, we have to identify and address what are the how the elder people are being abused by their own kith and kin and others, other society, what are the stigma they are facing. And it is really a public concern nowadays. So this also so here some action has to be taken by the forensic nurse. And human trafficking and exploitation, this is again. So this is also, it's a kind of epidemiological understanding of the complex issue. And infectious disease outbreak as in COVID-19, what we have discussed, investigating and controlling the outbreak are also can, for example, any tuberculosis. So this can be also be by identifying the epidemiological issues, we can make a remedy, how it could be corrected, or correctional of healthcare setting can be identified. And mental health epidemiology, nurses work with mental health issues, and thereby you can make some correctional remedies. And violence prevention and policies, advocate the evidence-based policy to prevent violence and address its epidemiological issues. So these are some of the epidemiological issues or risk which has been exposing nowadays, and how it could be rectified. This is mainly why this epidemiological issues to be known by the forensic nurses in order to make out some of the preventive strategy or correctional strategy in the health setting as well as the societal settings also. And coming to organ donation, it is organ donation. It does mean that when deciding to give a organ to save to transform the life of the individual. So organ can be donated while alive, called living organ donation. This organ and the tissues also can be donated from the people, those who have died. So in the situation where these organs can be donated, organs alone. So in case of brain death, when the patient is declared brain death, their organ can be donated. Everybody know that. And in cardiac death, after cardiac death, even organs like kidneys, liver, and lungs also can be donated. And drowning or asphyxiation. So in such cases where you can, the organs are being donated, any trauma cases, like for example, any road traffic accident or any injuries, organs like kidney and liver or lungs also can be donated. And if the patient is declared brain dead, the cardiac death, and homicide or suicide. We may be wondering how come in this case, how the organs are being donated. Yes, we can donate. In case where death occurs due to any homicide or suicide, organ must be donated if the investigation is complete. If the investigation is complete and the body is released only, some of the organs can be donated. And coming to unnatural death like electrocution or burns or organs can also be unnaturally, if any happens, this also can be donated. The organs can be donated. And post-mortem examination, after an autopsy, after post-mortem, some of the organs also can be donated if they are not required for, if there is not any further investigation to be done. In such cases, some of the organ also can be donated. And coming to tissue donation. So this is again, it is a process of deceased dead persons donating any part of their body for use of transplant procedure to repair the recipient physical injuries or trauma. For example, any heart valves or bones or tendons, some of the tissues from the dead body can be transplanted to repair a recipient physical injury or a trauma. So when it has to be considered. So tissues, when we can consider. So suspected child abuse or neglect. So the tissue sample can be collected for further investigation. And sexual assault cases from the victim for DNA analysis. Sexual assault, in such cases, it is very essential for DNA analysis, in where you can collect the tissues from the concerned victim. And homicide and suspicious death also, for example, for toxicology purpose and DNA analysis, and for other purposes, other investigation purposes, where you can collect the tissues. And drug-related death. So drug-related death tissues also can be collected for further investigation and toxicology. And unnatural death for burns or other cases. And post-mortem autopsy for that thing can be collected. And identification of the purpose, for example, samples can be collected for DNA identification, where the body is unrecognized, and in such cases where we can collect the tissues. And criminal cases involving weapons. This can be collected from the victims or the weapons for DNA analysis and evidence. And explosion or mass disaster. So this is again for DNA and identification and analysis and investigation purpose. Normally, the tissues are being collected. And historical cases. So here, the tissue can be collected from exhumed bodies, already digged bodies, for reinvestigation purpose, for reinvestigation. If you have any doubts of the death, in such cases, even after making a burial, again they will reinvestigate, result for that. These are the circumstances where tissues can be collected. And how it can be donated, in which are the cases how the tissues can be donated. So especially corneal tissues. So this can be donated for transplantation of any cause of natural death or brain death. Corneal tissues can be donated from the person who is already dead due to brain damage. or brain death. And the tissues can also be donated for burn victim or reconstructive surgery in case of natural or death. And bone and cartilage tissues also be donated for orthopedic surgeries in case of natural death. Okay. And heart valves can also be donated in cardiac surgery in case of natural death. And eye tissues also can be donated for some intraocular surgeries or research purposes also. It can be donated. And the brain tissues, it also can be donated for the research purposes. And musculoskeletal tissues can also be donated for any research purpose or if you further investigation, new, for example, development of any new treatment or therapy for which musculoskeletal tissues also been donated. And cardiovascular tissues, as I told, for the, again, development and research purpose. And neurological tissues, again, for any further investigation, for any research purpose or study purpose, for making, establish some new treatment or therapy for which it can also be donated. And again, for cancer research, for some of the tissues also been donated. So these are the circumstances. These are the situation where the tissues also can be donated for further medical purpose. And this is a time duration for transplantation. If it is a liver, 8 to 12 hours, it has to be transplanted. And for heart, 4 to 6 hours. For pancreas, 12 to 8 hours, we can within that hours. And lungs, 4 to 6 hours. If it is kidney, 24 to 36 hours, it has to be transplanted. And some of the tissues like up to 7 days, eye or cornea, heart valves up to 10 years. If it is cryopreserved, the organ should be, so there is a technique has to be followed. It is known by all the forensic nurses, how it has to be preserved. All the organs for transplantation, how it has to be preserved, everybody should know. So if it is cryopreservation, even 10 years also it can be preserved. And for digestive system, 6 to 8 hours and several years. And for bone and tissues, if it is cryopreserved, several years also it can be preserved. So what is the role of a nurse in organ and tissue donation? Identify the potential donors, coordinating with organs and procure organization. This main thing, the concern. So we have to go very ethically. It is because if we are not, if anywhere we are missing, it may cause a huge ethical issues. So what we are very keen about the law enforcement method and what is the concern we have to, the concern, obtain the consent from the donor or a recipient, everything, the matching has to be carried out, everything has to be followed. And preserving evidence also, it is very essential. And maintaining how we have to collect and package to be sent to the sample and maintain the chain of custody. What is the next? What is the next? How it has to be preserved? The custody, the chain of custody has to be followed. And see to that, the emotional support. The person who is donating, the family, a person is, just imagine that. Oh no, the one person died with brain damage, not died due to brain death. Simply like a statue, the person is, how would be the feeling of their relatives? The emotional support has to be given. So whether they are ready to provide, offer all the organs, donate all the organs. So that concern, it is really a delicate situation. So emotional support and facilitating communication, whether you have to have a transparency to the transparent to entire medical team and ensuring compliance. And for death investigation, each and every procedure of death investigation, the forensic has to be aware of what are the investigation could be done for that particular case. And supporting transplantation, encourage or motivate the transplantation organ donation, and collaborating with other professionals and educating one another. Even the self-education is essential. At the same time, educate the other person, other healthcare providers, and even the society about the organ donation, how it has, in which are the conditions where we can donate. So disseminate with regard to organ donation and donation as such. So here some of the do's and don'ts of forensic nursing. Just I will read. It is self-explanatory only. Document thoroughly. So as I told already, I am emphasizing that when with regard to forensic science or forensic nursing, we the nurses, forensic nurse should have 360-degree of observation. So I can say that simply look, we can say the full of our body should have some eyes, imagination, eyes we should have. So so document thoroughly and accurately. Each and every point has to be, it has got a value, so thoroughly and accurately, and handle evidence properly, and maintain chain of custody, and take photograph if it is necessary. The evidence has to be created, and collect and preserve biological samples correctly, according to the procedure wise, the process, how it has to be collected. Properly collect, methodologically collect, provide emotional support, and be the support to the victims and the family. Collaborate with the law enforcement and the agency, and stay up-to-date knowledge. Again, I emphasize, the knowledge which we have alone is not adequate. So up-to-date knowledge, day-to-day knowledge, we should update with regard to forensic nurse and nursing best practices, and respect patient autonomy. So we cannot force anybody else. So we have to respect the individual and maintain a confidentiality, participate in death investigation and autopsy as it is needed, continuously educate yourself, ourselves, myself, with regard to forensic nursing and related topics. And what are the don'ts? Contaminate evidence, don't contaminate evidence and compromise the same. There is no compromise in that particular crime scene. If anything flap, it is held responsibility. So you have to take up the responsibility. You are accountable to that. So don't contaminate evidence, no compromise. Don't fail to document and mishandle evidence. Do not ignore or dismiss victim concern and needs. So victim concern it has got a value. And don't compromise patient confidentiality and autonomy. Don't provide medical opinion beyond your expertise. Don't fail to report suspected abuse or neglect immediately each and everything. Be transparent. That's what. So that we can also safeguard ourselves and safeguard or protect the patient autonomy also, and health also, and safety measures also. And ignore safety protocol and put yourself at risk. Discuss cases with unauthorized individual. Don't discuss cases with unauthorized individual. Okay. And do not compromise the integrity of investigation and the legal process. This is very essential. And don't neglect to follow established policies and procedure. So these are some of the general, this is how we can promote public health and safety with regard to forensic nursing: injury prevention, health promotion, disease prevention, policy development, community collaboration, mental health, research and evaluation, and health education and cultural competency. So to conclude that, how the nurses should be. The forensic nurse should have the fast observation and respond to the evidence, noticing sharply or essential to identify the causality or cause. This is concept of mine. If we follow these criteria, forensic. So we have to have observation, 360-degree observation, respond to the evidence, collect the response, evidence carefully without any compromise. Each and everything has to be sharply notified, identify the cause and causality. So to conclude that, law is for all, and it includes all of us. Abide the law, get projected, evade the law, and get projected. Thank you. Any doubts, please, you're welcome. What is this? Anything else?
Thank you so much, ma'am, for that insightful and engaging session. We appreciate that valuable information you have shared with us today.
Any doubt from the side, from audience side? Is it clear actually?
Yes, ma'am.
So again, thank you so much, Dr. Alka and other organizer. Hope I have
Thank you, ma'am.
justification to present the session.
Thank you, ma'am. Thank you for your enlightening word.
Yeah,
Thank you, Maria. Very nicely you have taken.
thank you. Thank you, Sister G.
Thank you, ma'am.
Thank you, ma'am, for your enlightening words. Your deep knowledge and experience in forensic nursing are incredibly inspiring. We are grateful for the inspiring and perspective you have provided. As we conclude today's session, I want to extend our heartfelt thanks to Dr. Binu Matthew ma'am, Dr. Maria Trise ma'am for sharing your expertise, and to all of you for your active participation. We are looking forward to continue our webinar tomorrow with more insightful session and discussions. Please make sure to join us again at 2 p.m. on SAMLink for another engaging and informative session. Have a wonderful evening, and we will see you tomorrow. Thank you.